All right, good morning, everybody. We are going to go ahead and get started, and I will continue to let people into the Zoom as they continue to enter. My name is Christina Braga. I'm with ENV Insurance Agency. You may remember me from other meetings we have done, but the topic today that we are talking about is retiree dental and vision. And this is a completely voluntary option. So this is not something that the district is administering. This is all voluntary, and this is actually run through our ENV office. So we wanted to give you the information so that you could make the decision that's best for you. Jumping right in, just as on the active and retiree side for the commercial plans, the call center will be available to anyone who has questions about these products. I put our number there, 315-641-5848. We are available Monday through Friday, 8 a.m. to 5 p.m. You can also email us. I know a lot of retirees are really savvy on email. If that's the case, you can email the call center with any questions you have on these products. Also, you should know all of the information that you are sent home and much more is going to be located on the district website. So things like the provider directory, how to find a provider, details about the programs, all of that will be on the district website along with this presentation. For the purposes of this presentation, I did mute everyone. This will be recorded. So if you would like to watch this again, this will also be available on the district website. If you do have questions as I'm going through, please feel free to type them in the chat box and I will answer those at the end. You probably will find that during the presentation it will answer a lot of the questions, but I know I like to type it in the chat just so I don't forget what my question is. And then one more note is that when you are in the chat box, just make sure that it says send to everyone if you are sending a message. We found out in past Zooms, someone accidentally sent me a private message, but those unfortunately don't get saved. So we want to make sure we answer your questions. So if you do chat, just make sure that it says send to everyone. With that being said, let's jump right in. So what we're going to talk about today is a voluntary dental and a voluntary vision plan. You can take both if you'd like, or you can take one or the other. You do not have to take both. The dental plan has a blue and an orange option, and the vision plan has a blue and an orange option. You can take the blue for one and orange for another. They're interchangeable. So the reason they're orange and blue is because, you know, we're from Syracuse, we're big orange fans, so we named it after that. One very important thing to note is for the dental, you must have a New York address for at least 1 month of the year for the plan that we're going to talk about today. Now, let's say you live in another state full-time, 12 months out of the year. Still contact us. We will get you the most similar plan available in your state. Jumping right into the dental plan, let me give you some highlights. So I know that retirees don't have dental because you don't retire with dental through the district. So if you are going to the dentist, you're likely paying the full price with no discount. Having a dental plan right out of the gate typically provides a 25% to 35% discount on the services before the benefit even kicks in. So that's something important to know because these carriers are negotiating with these dentists. The dental plans we're going to talk about have a $1,500 annual maximum per person per year. That means if it's yourself and a spouse on the plan, you each have $1,500 to use towards dental expenses. So $1,500 is the maximum the carrier will pay out per person per year. 2 cleanings are covered 100% in network. Out of network, it's paid at 80th UCR. UCR stands for usual, customary, and reasonable. So basically they look at a zip code and they look at 80% of the dentists for each service and they look at what they charge for those services. So what that means is the 80th UCR, or that 88 out of 10 dentists, what they charge is what the reimbursement is going to be based on. What that really means to you is that if you go out of network, you're still going to have a very high reimbursement. This plan is not like that very low fee schedule lifetime benefits plan that was in place at Ithaca. It pays a lot more. In-network is always going to be the best benefit and the lowest out-of-pocket for members, but out-of-network is going to have a much higher reimbursement than you are used to. A vision fusion option. So this is very unique. Yes, we're still talking about dental, but let's say you're one of those folks that just has your 2 cleanings, and actually this year you're pretty good. You don't need anything else dental-wise, but you'd like to use up some of that max because you have it accessible. You have the opportunity through your dental plan, if you have unreimbursed vision expenses, you can submit for reimbursement, and that $150 will come off of your $1,500 annual maximum. So let's say I joined this dental plan, I ended up getting a pair of glasses, and I had some pretty expensive lenses, and my bill was $120. I could fill out a claim form, which is on the district website, attach it to my vision receipt, and submit it to Emeritus, and they will send me a check for that $120. And I can do that up to $150 per year. So that is very unique. It can be confusing because it is through the dental plan, but it is a reimbursement that every member has available to them. More details about the dental plan. Because it does pay more, there is a deductible per person per calendar year. So if you do need services, you pay the one-time $75 deductible, and then you can get up to your $1,500 reimbursed for that year. Waiting periods, I want to spend a little bit of time on. So you can see it says preventive, there's no wait. Basic services, there's a 6-month, and major, there's a 12-month wait. As of recently, we've been fighting with the state, and we actually won our battle, which means if you were to come on this plan by the very latest November 1st effective date, you will have no waiting periods no matter what. So even if you have not had dental coverage for 5 years, as long as you enroll by November 1st, you won't have to wait to get any services paid. After November 1st, members will have to show that they have had dental coverage within 30 days to have those waiting periods waived. So that's important to note. We talked about that eye care fusion benefit, which is $150 per person per year. And then for enrollment, you must be enrolled in the plan for 12 months. And with this plan, if you term at any point, re-enrollment is not allowed. And the reason we do that is to protect the rates and help to stabilize them. What we found in the past is that people tend to elect the insurance when they need it. So what was happening was people were jumping in, having the plan pay for their very expensive procedures, and then jumping out. But what that was doing is that was making the rates way more expensive for everyone. So by having this provision, it keeps the rates as stable as possible for the members that really need that dental coverage. Here's a snapshot of what the dental plan covers. The blue is on the left-hand side and the orange plan is on the right. And you'll see we have an in-network column and an out-of-network column. Preventive services are things like exams and cleanings, bite wing x-rays, full mouth panoramics, and probably fluoride treatment isn't applicable. But in-network, those services are covered 100%. So if you go to an in-network provider, you will have no balance bill. Everything will be covered in full. If you go out of network, you can see it's 100% covered of the 80th UCR. So remember, they look at that, what 8 out of 10 dentists in a certain area charge, and that's what they base the reimbursement on. So if your dentist is one of those dentists that likes to charge a lot more for services, he or she could potentially give you a smaller balance bill. But the good news is it is based off of 8 out of 10 dentists in the area, so your reimbursement is still going to be very high out of network. Under basic services on the blue plan, you can see it's covered at 80%. So for instance, a restorative amalgam or composite, the plan will cover 80% of that, and the member will only cover 20%. Okay, we're actually going to get into a specific example with an amalgam filling on some future slides. Under the orange plan, it's 60% coverage for basic. So the member would pay 40% if they needed a restorative amalgam, composite, or simple extraction. Same thing with the out-of-network, right? So the plan's going to cover 80% of the 80th UCR. So remember, what 8 out of 10 dentists in the area charge, I base my reimbursement off of that. Whatever that number is, the plan pays 80% and the member pays 20%. Okay. Under major, both plans cover 50% of general anesthesia, root canals, complex extractions, endodontics, periodontal procedures, dentures, and crowns. So that's covered at 50%. Now here's an example, because we know UCR can be very confusing. So let's say you received a restorative amalgam filling at an out-of-network provider. We're going to talk about the blue plan just as an example. Okay. For this blue plan, amalgam fillings are covered at 80% of the 80th UCR. So below is an exact number. So in the zip code of 14850, the 80th UCR charge is $143 for that amalgam procedure. Okay, so we take 80% of that, which means the plan would cover $114.40. The member would be responsible for the $28.60, right? That's the 20%. Now, there is a chance that the dentist could want a little bit more than $143. Let's say that dentist wanted $150 for an amalgam filling. In this case, the member would pay their co-insurance, which is the $28.60, and then they would pay the $7 to make the dentist whole on what they wanted to charge. And that varies dentist by dentist. But what's really important to know is the bottom bullet here. No matter what procedure you are getting, we recommend that you ask for a predetermination before the service. This means the dentist will give you an idea of what your out-of-pocket costs will be before you even have the service, so that there's no surprises. Remember, going in network is always going to be the lowest out-of-pocket cost, but if you are out of network, ask for a predetermination. That way you can get an idea of what your costs are. Okay, now we are going to do a crown example. Let's say you need an emergency crown, but either you can't wait to get into your in-network provider, or you just happen to choose an out-of-network provider. Both the blue and orange plan cover crowns at 50% of the 80th percentile. So we have an exact example. So in zip code 14850 at the time, the reimbursement, the time that we pulled this information, the reimbursement was $1,125 for a crown. That was based on what 8 out of 10 dentists in the area charge. So the plan covers half of that. So the plan would cover $562.50. So that means the member would be responsible for the remaining $562.50. On top of that, remember that if the dentist did want more, they could give you a slight upcharge. Also keep in mind, in this example, you're paying $562 for a crown. In network, you would pay less than this. I've seen crowns around the $300 range even for in-network. So keep in mind, while this does still provide you a nice reimbursement, you'll pay a lot less in-network. And again, the bottom bullet, just make sure you ask the dentist for a predetermination. So if you know you have to have a crown, you would just ask for them to give you a predetermination, and then you can see all of your expenses, and you would know up front what the dentist would be charging. We wanted to give you an idea of some dental providers in the Ithaca area. There's a full searchable list on the district website, and here's actually the screen a little bit bigger just so you can see. We just took one page to show you some of those. Also keeping in mind the actives on the Ithaca plan also have emeritus for dental, and emeritus is who this dental plan would run through. So you'd have the same network as the current active population. But if you'd like to see all the providers, we're going to go over how to find a provider, but you could also just go on the district website and search the full list. We actually pulled a 50-mile radius for members just to make it easier, and it goes by county. Here are the dental plan rates. These are monthly rates. So we have the blue plan and the orange plan. So in the blue plan instance, that rate times 12 ends up being just under $600 for the year, and you'd receive a $1,500 benefit for that year. Okay, as far as the orange plan, just to give you an idea of an annual figure, that's less than $550 for the year and still gives you that $1,500 benefit each year. Okay, I'll stop there and see if there are some dental questions in the chat. All right, the first question is, are the new optical and dental not available outside of New York State? So as long as you have a New York address for 1 month out of the year, you can have this program. If you're outside of outside of New York State full-time, we would set you up with a specific dental, but the vision you'd still be fine with. And we're gonna get into the vision in just a minute. UCR we went over, that's the usual, customary, and reasonable. So that's how they figure out the reimbursement. They base it off of the area. So each zip code can be a different reimbursement, but the good news is it's a higher reimbursement. The next question, how long is the presentation and when do things change with Aetna? So this actually has nothing to do with Aetna. So this is completely voluntary. This program doesn't run through the district. The Aetna, I believe the board meeting is tomorrow, and that's really all I know about the Aetna as of this point. The next question, you're saying diagnostic prevention is covered 100%, but you still need to pay the deductible, right? That's correct. So for your first cleaning, you would have to pay your deductible. Your second cleaning, as long as it was in the same time frame, you would not have to pay your deductible because it would already be met, and then that would be covered in full. You're understanding that correctly. The next comment, you are using $143 for generic filling. I'm more used to paying close to $300. And that goes back to the point where if you don't have insurance, you're paying a very full price. So just having dental insurance alone typically gives you access to a discount. So I think you'll be surprised how much you save out of pocket by using this dental plan. But the $143 is an exact charge for the Ithaca zip code. The next question, where on the ICSD website? So in talking with Casey Bangs, she was going to make a more visible retiree section, and all of these documents should be right under there. If anybody has a hard time finding that though, please definitely let our office know and we'll communicate that with the district. What does EE mean? So EE is employee, and then EE plus 1 is employee plus 1. So if it's you and your spouse, that would be your monthly rate. The handout doesn't mention no waiting period if you apply before November 1st. Probably the handout you got wouldn't reference that. This is something we just very recently got approved by the state, and we were excited to do that so people wouldn't get harmed. So what I'm sharing with you is the latest and greatest, and the district website will have this information as well. So please reference that, and you will have no waiting periods as long as you enroll by November 1st. Our son is 22. If we drop out, can he still stay on? Unfortunately, the plan has to have an Ithaca retiree as the primary sponsor in order for family members to be on. If we are all Ithaca retirees, why is there an in and out of network? So the in and out of network just has to do with what dentists participate with emeritus. So some participate and some don't. So that's why it's important to check the website to see which dentists are participating. Is coverage calendar year or the beginning date of the enrollment? Great question. So the coverage is actually calendar year, and this could benefit you because so is the fusion. So this year, if you couldn't possibly use $1,500, You can still use your $150 reimbursement if you go to get glasses, let's say, and you can claim the $150 now. And then let's say you needed contacts after the first of the year. You can get that reimbursement again. So it is per calendar year. How is the area defined for UCR? It's zip code. So they look at all the zip codes. There's actually a very complex software system that pulls in all the areas and all the different dental services and provides that. Mary Jo says, unable to find the dental list on the website, so I will contact the district and just make sure I can get that direct link for everyone. Is there an option we could have that requires no fee that current employees have? So all the dental that's through the district right now requires a fee. And also there's multiple offerings. So I'm not sure quite what you mean by fee, but all of them do have payroll deduction and cost at time of service. The coverage would start when you turn in your paperwork. So if you were to get in your paperwork now before October 1st, your coverage would be activated October 1st. If you got it in by the middle of October, you would have a November 1st effective date. So as long as it's in before, you'd have that effective date. Who is included in family? Could my 23-year-old daughter be included? Sure, why not? If it's just you and your daughter, that's employee plus one, but if it's, let's say, yourself, a spouse, and a child, that could be included in family, yes. Just to be clear, each person must pay a $75 deductible yearly. Yes, that's correct. So you each have the $75 deductible, but you also each have a $1,500 allowance to use. And also you each have a $150 vision reimbursement. So that being said, I'm going to jump into the vision. You can keep your questions coming in the chat, and I'm happy to answer those for you. So vision highlights, the vision plan is actually going to be through Versant Health or Davis Vision. It's going to provide a broad array of different coverage, low member out of pocket. There's a 1-year breakage warranty on glasses, which is great. There's also a 50% discount on additional pairs of glasses, depending on where you go for your services. Standard scratch resistant coating free of charge. And just like the dental plan, once you're enrolled in this, you must remain in the plan for 12 months. And if you do term at any point, re-enrollment wouldn't be allowed. This probably looks very similar to what you got at home. But again, Vision has the blue plan and the orange plan. The blue plan is a little bit richer. You can see that your eye exam, lenses, and frames on this plan, you can get every 12 months. On the orange plan, you can get an eye exam every 12 months, but lenses and frames only every other year. So if you're somebody who likes to go to the eye doctor every year, but maybe you don't need glasses every year, the orange plan might be the best for you. And then it just goes down and says what the corresponding copays would be. So on the blue plan, an eye exam is just a $10 copay. On the orange plan, it's a $15 copay. You have a $140 allowance on the blue plan, but up to $190 if you go to a Vision Works. So they give you a little bit more coverage if you go to a specific location. On the orange plan, your allowance is $120 for frames, but up to $170 at a Vision Works. And you can see the different frame collections that are included. On the orange plan, there's a little bit of an upcharge for some of the fancier frame collections. Then they just detail if you were to need any specific type of coating or lens, they list all the corresponding copays here, which you really don't need to know unless you have these. And at the time of service, they'll go through these details of your plan and they would tell you what your copay would be. So I just wanted to list this, but everybody also has a copy of this at home. Continuing on just with contact lens benefits, it matches the regular lens benefit. There's a discount on all lens types above and beyond. The very bottom, it goes over the out-of-network reimbursement schedule. With Vision, most all folks are in network because you definitely get the best benefit. So let's say you have an eye doctor that you love, but they are out of network. This will show you what you would get reimbursed for some of those different services. Keep in mind, let's say you really like an eye doctor and you want to go to him or her, you don't have to get your frames or lenses from them. You can get a script and go to a VisionWorks to get more of an allowance, let's say. So you can split that up to get the most out of your vision plan. But again, the out-of-network reimbursement schedule, that is different than the above because that shows what you could get reimbursed. Local vision providers, just to give you an idea, there's an Empire Vision Works on Meadow Street, Optivision, America's Best, and Walmart, just to name a few. But this provider listing is also going to be on the district website. Here are the vision rates for you. So you can see again, EE is employee, EE plus 1 means 2 people, and employee plus family basically means 3 people. So if you were to take the blue plan, the annual cost of that plan is just under $86, and you could get up to $140 or $190 allowance each year. Okay, on the orange plan, to give you an idea, the cost is about $60 per year. And again, you have that $120 or $140 allowance each year. Just some more housekeeping items. Here's how to find a provider, and this is on the district website too, so you don't have to take notes. We walk you through the website. If you're looking up vision, depending on which plan you want to take, there's a different code, and I'll actually show you a screenshot of that so it looks familiar. And then below, we show you how to find a dental provider, and you're going to select Classic PPO from the drop-down list. Here is a screenshot of the Vision website. So it came to our attention that once you click on members, it came up with username and password. But underneath that, you can see it says client code. That's where you're going to type in either the 3983 if you're choosing the blue, or the 3984 if you're thinking about the orange. And then that will help you find a vision provider. So how do we enroll in this dental plan? There is an emeritus application. It's called an individual insurance form. Please be sure to list Ithaca City Schools under your affiliation. So while this is not a district-sponsored plan, it's a way for ENV to track how many retirees take the plan. So please make sure to put that under your affiliation. You can enroll in just dental if you want. You don't have to enroll in both dental and vision. And then you just pick whether you want the blue or the orange. In addition, you'll complete the ENV payment verification form. And then if you want ACH, there's an ACH form. Again, these forms will be on the district website, or you could even email or call the call center and they will get those forms to you. How can I submit the forms? So I have all the forms ready to send in. What do I do now? You can scan them and email them to callcenter@insurewithenv.com, or you can mail them to us, and I've provided the address there. Just keep in mind, if you are trying to meet the deadline of October 1st or November 1st to avoid waiting periods, we would have to receive the paperwork in advance of that. So just keep in mind, the post office can be a little bit behind in their mailing. Reminding you how to waive waiting periods for October 1st. As long as we have the forms in hand by end of September, you can have an October 1st effective date. If you'd like a November 1st effective date, just submit all the forms by the end of October. Anything after that point, it will be required that you submit proof of dental coverage, that you've had dental coverage within 30 days to waive those waiting periods. Vision forms, same thing. If you just want to enroll in vision, you can, no problem. You don't have to enroll in both. There's a separate Davis Vision enrollment application. And then you'd complete the ENV payment verification, and you'd complete the ACH form if you wanted to do automatic payments, and also send it to our office. You can either scan and email it, or you can mail it to our office. If you are taking both vision and dental, you do not need to fill out the ENV payment verification form twice. You only need to fill it out once. ENV handles all the billing, and we work through ProFlex. So ProFlex is the billing vendor, but ENV manages all of that. So that's really all I have today. Thank you for your time. I'm going to open it up to the chat box and make sure I can answer everybody's questions. Okay. The question is there an age cutoff for children? I believe the most recent age cutoff is 26, but I will make absolutely sure. New York State likes to change things up on us, so I will be sure that that cutoff is 26 for you. If your dependent doesn't live with you, can they still be on your dental if they're out of state? As long as you are in New York State and the policy information is going to go to your house, they should be fine. And then it does have to be your legal dependent. So a dependent that you claim, as long as that's the case, you can certainly add them to your dental. This price are for participating providers. I'm not sure if that's in reference to the dental or vision, Bob. I might ask you just to clarify a little bit just so I can make sure I'm answering your question to the best of my ability. Okay. Out of the 34 dentists listed in Tompkins County, 26 are Aspen Dental or Wilson Dental. Yes, that can be common. Unfortunately, the Aspen Dentals of the world are just scooping up all of these individual offices. So probably a lot of the dentists around there that you were going to, they might be in Aspen and you might not even know about it. So yeah, definitely keep checking. There's other dentists on the list besides Aspen. And then if there's something you need help with, just call our office and we can certainly look up a provider if you have a specific one in mind. Can you enroll in just one? Absolutely. If you just want to enroll in the dental, you can, or just the vision, you can. All you have to choose is whether or not you want blue or orange. What do you mean by allowance for the year? Is that a maximum? So on the dental, you get a $1,500 allowance. So that is how much the carrier will pay for you if you're talking about the dental. If you're talking about the vision, depending on what plan, yes, that is the maximum the plan will pay on your behalf. So if I take the highest plan and I go to VisionWorks, I will get a $190 allowance for my frames in a year. So that's the maximum they pay out. If it's less than that, great. But if it's up to $190 at a VisionWorks, I can take advantage of that. How do you pay? You would just complete those payment forms and send those to ENV, and then we process payment however you'd like that to happen. Does vision cover glass lenses? Yes, there's a frame and a lens allowance. So if it's a very fancy kind of lens, there might be a corresponding copay, but that would be shown in the grid. And again, you can always ask your vision provider ahead of time if you know you need a certain kind of lens, and they can look up what your plan will pay for. What does it mean when the waiting period says 0612 on the dental? So in the form you got home, you might see it says 0612. That will not apply as long as you enroll before November 1st. But if you don't enroll by November 1st, 0612 means there's no waiting periods for preventive or cleanings. There's a 6-month wait on basic services, and there's a 12-month wait on major services. So what that means is the carrier wouldn't pay out on services until those waiting periods were met. But again, that's after November 1st. If you enroll beforehand, you don't have to worry about that at all. The pricing allowance for vision is just for network providers. Yes, there is an out-of-network reimbursement schedule, but the pricing allowances we were talking about are for in-network providers. That's correct. I missed the beginning. This is not a district-sponsored program. Why is it being offered? What about other plans? So that's a great question. So right, this is not being offered by the district, but what we've been tasked with over the years is we work with many districts where the retirees don't have dental and vision, and going into the open market as an individual plan can be very expensive and also can have set waiting periods that we can't get around. So what ENV was able to do is kind of pool groups of retirees together to try to get more stable pricing and try to get the best benefit. So while the district endorses this program, it's not administered by the district. They just wanted to make sure that retirees had the option should they want dental or vision coverage. So long story, but we basically have scoured the market, and this seems to be a program that works for a lot of our retirees. That seems to be better than just going out into the individual market. Do you do electronic payment? Yes, so we can do ACH. We can set up automatic payments. You would just indicate that on your form. So even though your plan, let's say you got your paperwork in and you have an October 1st effective date, your maximum and your fusion and your deductible would reset January to January. So you are correct. The underlying guts of the plan reset January to January, even if you come on, let's say October or November. Do you pay at the time of service and then make application for reimbursement? That's a great question. It depends on your dentist. Some out-of-network dentists will still send in the paperwork for you, and same thing with vision providers. It really depends. Some won't. So in that case, you'd have to pay and then submit for reimbursement. My blended lenses and frames can cost up to $600 plus examination. How much will be reimbursed total? So Harlan, I'll have you probably give me a call only so I can get the specific kind of lenses, and then I can get an idea of what you'd actually have to pay or what would be reimbursed, because it does depend on the kind of lens. Can you pay ahead, like for 3 months, 6 months, or 12 months? Absolutely. In fact, most of our retirees do pay either every 6 months or 12 months, just so that they don't have to think about it until next year. So those are options that are available. Can you clarify when the plan starts? So the plan starts the day your paperwork gets in, the first of the month following that. So if my paperwork is in and submitted by September 20th, October 1st will be my effective date. I can start using the plan. My deductible, let's say I have a crown, I go through my deductible and my $1,500. In January, that resets in case, let's say I need another crown. I can use that fresh benefit again in January. Next question, through COBRA, we have Emeritus Low Dental. How does that relate? Great question. So the Emeritus Low Dental is a low fee schedule plan. So it is very inexpensive, but it covers, $7 to $8 for a cleaning, or, very low amounts. You certainly can keep that until December 2021. As soon as COBRA is done, you would call our office and let us know that you want to sign up for this plan if you do. If you do that, then you would have no waiting periods, because you can show that you've had dental coverage within the last 30 days. So you would not be harmed by any waiting periods. If you join dental for November 1st, you still have a $75 deductible for the 2 months of 2020. Yes, if you do use it for November and December, you'd have your deductible of $75. It really benefits, like I said, those people who have to get major dental work now and then want to get major dental work again in January, right? Or people who have unreimbursed vision expenses coming up. You can take advantage of that $150 now and also in January. Does the vision only cover eye exams and eyewear, or does it cover procedures like cataract surgery? Great question. So if it's a medical related vision expense, that would likely go under your medical plan. Okay, the deductible does start over in January. We talked about that. Do I pay the full premium even if I'm delayed from benefits due to waiting periods? So right now, nobody will have waiting periods. So if someone were to enroll, let's say, after November 1st, you would still pay the premium, yes, but you'd have the waiting periods. So the premium doesn't get delayed because of the waiting period. So that's why it's important, if you do need dental work and you do want to come on, that you do that by November 1st at the latest. Can you get the $150 allowance for vision if you have the dental but do not have vision? Great question. Yes, if you just take the dental and let's say you don't want the vision, you still can use that $150 allowance even if you don't have vision. If you do have vision also, so let's say I'll pick on Harolyn because she had the question. Let's say Harolyn has very expensive glasses and she has the dental and the vision. She can use the allowance under her vision plan, and then whatever's not reimbursed, she can tap into this $150 under her dental plan to pay for the rest of that. So it can work either way. You don't have to have vision, but if you do, it can help you out even further. This presentation, right after I download it, I will send it right to the district and it'll be on the retiree site. I am going to work with them though, just to make sure that it's a little bit more visible so everybody can find it very easily. Worst case scenario, you can contact our call center and they will get it right over to you. That way you have it. Can you switch from blue to orange once enrolled and vice versa? Great question again. I believe once per year you can switch. That's another thing we're waiting on the state for. So in addition to the age 26 question, I will also get back to you on whether or not you can switch once per year. We're just waiting for the state to clarify that. Great questions, everyone. I really appreciate your time. I'm going to stop the recording and then I will stay on a little bit in case anybody else has questions.